Welcome to PodcastRx, a production of Diamond Pharmacy Services. This is a show about pharmacy, but don't let the title fool you. While we definitely talk with pharmacists about medication topics, we also sit down with nurses, technicians, and other pros to discuss relevant issues in corrections health, long-term care, and so much more. Whether you're a pharmacist, a practitioner, or just find these things fascinating, this is a show for you. On this episode,
the virus that we're dealing with now is not quite the virus we dealt with back in March and April. So it's changing, and we're learning ways of changing with it.
Debbie Yackuboskey is a registered nurse practitioner, a nursing consultant, and Diamond's infection control coordinator for the past 17 years. With the outbreak of the COVID-19 pandemic, Debbie suddenly found her infection control expertise put to the test in unprecedented ways as she worked to protect Diamond staff and customers against the novel coronavirus. She joins us to talk about these planning and response efforts, the occasional challenges in applying CDC and state guidelines to pharmacy operations, and the impact of COVID-19 on her work as a nurse educator and med exchange supervisor for long-term care facilities. I'm Adam Campbell, and this is PodcastRx. All right, I want to welcome to the podcast Debbie Yackuboskey. She's an RN consultant and the infection control coordinator for Diamond Pharmacy. So before we get into the heart of the discussion here, Debbie, I'd like to learn more about your role. I've worked alongside you now for 6 years. I've been with the company, and I know you're the infection control coordinator. You run our wellness clinic here, but I know you do a lot more. So can you tell us how long you've been here, how you became the infection control coordinator, and what else you do here?
Yes, Adam, and thank you for inviting me to the podcast this morning. I have been with Diamonds for approximately 18 years now, going on my 19th year, and I originally was hired as the RN consultant. I have been a long-term care nurse for many, many years, and I have had a variety of roles in long-term care, all the way up to the director of nursing. So I do know long-term care inside and out, and obviously that is one of the focal areas that Diamond provides services to, or to personal care homes and to skilled nursing facilities. So I began as the RN consultant, and after about a year after I was here, I was asked to assume the role of infection control coordinator, which is not new to me. In most of my administrative positions in long-term care, that's usually been a responsibility of mine to be infection control. So it's not something that's new. What was new was just it was a different genre. It was not solely long-term care, and obviously Diamonds is a larger scale company than some of the other companies that I was used to working for, in addition to the fact that Diamonds is located in multiple locations as well as multiple buildings. So those were some new areas because we are much more larger than what I was used to, but it has been very challenging at times, but it's also been very rewarding at times. So I've been infection control now here at Diamonds for about 17 years at this point in time.
Well, infection control is a big part of today's talk because I wanted to talk to you about infection control with COVID-19. Now, we had actually wanted to do this episode back in March. So to tell a little story about how we finally got here today in August, so we need to go back to February 2020. This, of course, is when coronavirus and COVID-19, they'd been in the news for a few months prior, and it only had been seen in a few states here in the U.S. But, of course, there are definitely concerns about the impact it could have, especially in long-term care facilities. So being the infection control coordinator here, and, of course, your experience with long-term care, what do you remember about the early days of the pandemic and your assessment of how serious it could be?
Well, obviously, with it starting in Wuhan, China, and that being so distanced from Indiana County, Pennsylvania, we were watching it, but we weren't so concerned because, of course, it was international at that time. as it began to grow and spread to other portions of the country, and definitely as it got into the northwestern portion of the United States, it did start to get closer for us. So our awareness started to heighten. We started to watch more seriously because of the fact that it was affecting so many individuals so rapidly and starting to cause a lot of deaths in a lot of areas. And then as it continued to migrate across the country and it got onto the eastern side of the United States, definitely it started to hit home even more because of the fact that it was getting closer to us. So we really started to try and develop a plan, and we gathered a whole host of individuals within the organization together so that we could be prepared in the event that we found it in our backyard.
And we essentially did. It was just a few weeks before it showed up here in Pennsylvania. And so going back through our emails, I thought this was really interesting to add some context to this episode. So we had planned to record this episode we're having today. It was March 12th was our scheduled date for you and I to sit down and talk about this. That was a looming threat at the time, but suddenly the looming threat was right here. And I just want to quote the email that I had written to you. And I said, quote, "Given the focus on all things coronavirus lately, I thought it would be fitting to dedicate an entire episode of our PodcastRx show to infection control procedures. I was wondering if you would be open to sitting down and talking to us about this. As an infection control coordinator, I'm curious what kind of steps you would take to deal with the potential effect of a novel virus." And quote, and you just mentioned you started to develop the plan then. So let's fast forward to March 6th of 2020. On that date, it was announced that COVID-19 had made it to Pennsylvania. And of course, for listeners, that's our home state. We're here in the western part in Indiana, Pennsylvania. Over the next few weeks, things got reasonably chaotic, not just around here, but of course, everywhere else. And we had you on the schedule to record for March 12th, but that was not to be. By this point, there were 22 cases in Pennsylvania, and the following week saw confirmed cases in PA increase from 22 to 133. So we're starting to see some of the first cases here in western Pennsylvania too. So of course, we see that things are escalating. I send you an email on the 12th asking if we could postpone, because I assume by this point you're very much in the thick of planning, as you just mentioned, and you were very much in favor of that postponing. And your last email to me on the subject simply read, "Thank you for understanding. Hopefully next week will be better." Well, next week wasn't better, nor was the week or the months immediately following. So here we are in August, finally getting to talk about COVID-19. And as of today's recording, there are 4.6 million total cases in the U.S. That's the cumulative total, with over 150,000 deaths. That's according to the CDC. And the virus, of course, is surging in places like Texas and Florida, for example. So to say that this has been top of mind for you these last few months would be quite the understatement, I'd imagine. So let's get a sense of how you managed it. You mentioned the planning. What were some of the other first moves that you made as an infection control coordinator to face this threat head on?
Well, obviously, as it got closer to our organization and our area, and it looked like it could have an impact for us, several of us got together, including our IT director, our pharmacy manager, myself, our safety director. We sat down and we started looking at our business continuity plan. Obviously, with any business, if you have a threat such as the coronavirus 19 that has the potential for affecting your operations, you just want to make sure that you have a sound business continuity plan in place and that you have made accommodations for any type of interruptions in services that might arrive because of the coronavirus or because of the fact that you are affected by the virus, your staff might be affected by the virus. Looking at other parts of that continuity plan, just how it would impact getting the medications and the medical supplies that we needed to give to our customers, how it would impact ground shipment. We rely heavily on ground shipment companies in order to get our medications and our medical supplies out, how that would impact ground shipment. So we looked at our business continuity plan and tried to ensure that we had everything shored up in the event that we had variables that were beyond our control that would impact our business. So that was the very first thing we did. We sat down and spent a long time just reviewing our current business continuity plan and looking at what we needed to add to it or delete from it in the event that the COVID hit our organization. So we, however, have been very fortunate in that respect. Even though we had a shored up business continuity plan, we've been very lucky in this area, and we've been able to get the medications that our residents and our customers need. We've been able to provide the majority of the medical supplies that are needed. Mm-hmm. Obviously, we are in the same boat with everyone else when it comes to the personal protective equipment, when it comes to the hand disinfectant, when it comes to gowns, gloves, masks. We're in the same boat. Mm-hmm. So we've been pretty successful in getting some products out there, and I think a lot of that has to do with Mark Zillner, who is one of the owners of the company, who has really taken a step up to the plate and has been trying to acquire anything that we have needed from any source that he might, including some international sources as well. So I really have to commend Mark for stepping up to the plate and providing that. Once we got the business plan in place, and then, as you mentioned, it kind of hit the back door for us, then we had to be prepared as to how we were going to keep our staff safe. You can't have an operational business if you don't have staff that are going to be here to help run that business and to do what they are normally asked to do during the course of the day. Now, obviously, we have been following the CDC guidelines. We've been following the PA Department of Health. So we've done a lot of different things that we have in place, which I'm sure we'll be discussing throughout this podcast. But we wanted to make sure that our staff was safe so that we could continue with business. And then once we were assured that we could provide safe venues to work or work at home options for our staff, then we just started looking at what was the information out there provided by the CDC, what was the information provided by the PA Department of Health. And we've been pretty successful following those two organizations as far as recommendations, because obviously the CDC, the Centers for Disease Control, is the leading authority with infectious disease processes. And us being located in the state of Pennsylvania, we're adhering to what PA Department of Health is saying and what Dr. Rachel Levine and our Governor Tom Wolf are guiding us through and recommending that we do. So we've been pretty successful just by following the guidelines that are out there, by adhering to the recommendations, by working with our staff. A lot of education has been done with our staff so that they are aware of COVID-19 and they have a good handle on, what it is, what are the signs and symptoms, how they can protect themselves, what they need to do in the event that they would have signs and symptoms. So education's been a big key. Some surveillance on my part and some other individuals in the organization just to ensure that mask use is being adhered to, social distancing is being adhered to, those types of things. And just some nice, trying to keep employees positive. We've had a lot of individuals just going around and providing positive, upbeat comments to employees and answering questions that they may have, to show that we're there and that we're there to answer the questions and we're there to help with any fears that they may have regarding the pandemic. So I think that has gone a long way. It's just a lot of hands-on by a lot of individuals in our organization.
Definitely. And And certainly education is so key because I imagine too, in the wider world, there's a lot of misinformation about the nature of COVID-19, treatments for it, the proper protocols for infection control. Do you find that frustrating in your day-to-day work? Does that ever creep in? Do you get frustrated with that?
I do, Adam, yes, because of the fact that you can have good information that's out there by leading infectious disease professionals, and you have always a group of people who, whatever the reason is, don't want to take the advice and the recommendations of those individuals. And, it's been frustrating when we're trying to adhere to all of the recommendations internally as an organization, and you can go out publicly and see something totally different.
Right.
And, how can you, it's hard to try and keep it moving inside when you have people that aren't doing it outside.
Right. But as you said, though, as an organization, we have a relatively easy time adhering to the guidelines, whether it be the CDC or the state. So I wanted to ask, what about our operation was specifically challenging in that regard?
I think the biggest challenge has been the social or / physical distancing, as they're calling it now. Obviously, we are confined to so much physical space in our buildings. And a lot of our individual employees are working side by side each other, either in cubicle spaces or just side by side in desks or on our pharmacy floors. They're standing side by side at pharmacy tables and they're filling medication orders. So it's very difficult to keep individuals in those kinds of environments a minimum of 6 feet apart. And also, it's not a dynamic process because individuals are moving about in these areas. So you're not asking them to stand in one spot while they're working and stay 6 feet apart from each other. They're having to move about. They're having to go to shelves and to boxes and the whatnot to get supplies, medications, etc. So they can't physically distance, and that's been a big challenge, is trying to keep everybody safe even though we can't keep them 6 feet apart. And that's primarily on our pharmacy floors. Now, in some of our other areas, it's been challenging, but not quite as challenging, in the fact that we've been able to send a certain proportion of our employees home to work. Now, from the challenge of an IT perspective, our IT department has needed certain requirements from the employee at their end in their own home in order to make it work for them to work from home and have the requirements necessary from the IT perspective. So we do have over 200 individuals who are working at home and who have successfully been working from home and have been productive as well. That's one thing we've been able to monitor, is the level of productivity of the employees working from home. So keeping them productive, keeping everything HIPAA compliant while they're working away from home, making sure that the equipment is flowing correctly so that we can be communicating with customers, we can be getting the orders that they need, and we can be getting them out to them. So that's been another challenge. Another challenge has been the fact that sometimes our ground shipping has their own problems. FedEx, UPS, some of the other ground shipping companies that we use, there's been times when, for whatever reason, they can't deliver. So products that should have gotten to our customers in a timely fashion sometimes just have not made it there. The mask use initially was a problem, looking at mask use, because, of course, you always have that component of individuals who it's my right, it's my choice, it's my freedom, it's my amendment, whatever their reason might be. to adhere to a mask or wear a mask. So mask use initially was a challenge, but over time, with just some surveillance, with education, with leading by example, you never saw me out there without a mask.
Sure.
Just leading by example, and with some of the other higher level administration out there doing the exact same thing, we were able to get kind of everybody on the so-called bandwagon with mask use. So that's been good. And another thing I think that helped is we developed what we call our COVID team to help with some of the challenges that we were experiencing. And this team is a multidisciplinary team. It includes myself as infection control coordinator. We do have Mark Zillner on there, who represents ownership and higher level management. To ensure that we were doing things legally, we have our corporate counsel on board on the team. We have our pharmacy manager on the team, and we have multiple buildings. So we have individuals who manage out of other buildings who are on the team so that they can be conveying the information and they can be kind of surveilling and monitoring their respective sites, because we do have sites in Ohio, Central PA, Eastern PA, and we have multiple buildings here in Indiana, PA as well. Our medical supply director is on there to ensure, that we're able to procure medical supplies as needed, as well as human resources, because we're dealing with our employees. So we need to have some input from human resources as well on that. So we have about 14, 15 members on the team. And initially we were doing teleconferencing Monday, Wednesdays, and Fridays.
Okay.
To try and get the ball rolling and get everything going. And then over time, as we found that we were getting a pretty good handle on what we were doing internally, and it seemed like that the employees were doing their part as well, we were able to bump those meetings back. So at this point in time, the meetings are only every other week. And we again continue to do teleconferencing, and that we do that every other Tuesday at this point.
Great. That ties in some to what a question I wanted to ask, that as you were talking about that, like when you got all the business continuity plan and all that figured out in the early days of the pandemic, were you still meeting just those 3 days a week, or were there like a lot more 11th hour type discussions?
There were a lot more 11th hour type discussions because things were changing so rapidly.
Right.
I mean, and it continues to change rapidly, but not as rapidly as initially, because I think at the onset, when it actually hit the back door per se, that's when you really started to put that plan into action. I mean, we had the plan, we knew what we were doing, but until something is in your backyard per se, you really don't have to implement too much. You've got the plan, but then you have to implement it, and we had to heighten everything. We had to kind of fast forward everything. We had to just get everything in place and getting it moving to protect our employees, to ensure that we were providing our services, or providing the medications, the medical supplies, and getting everything done that we needed to do for our customer base.
You mentioned customers, and something I wanted to ask you. So because we have these thousands of customers in different areas, corrections and long-term care, those are, of course, both vulnerable populations for COVID-19. So what kind of moves specifically did we as a company take in protecting our customers?
We've been working very diligently with all of our long-term care customers and correctional customers. Prior to the pandemic, a lot of the interaction that we had with our correctional customers was mainly by emails, telephone, faxes, those types of things. Now, we do have a core group of pharmacists who oversee correctional consulting. As soon as the pandemic hit, we stopped all business travel. Anybody who was out was brought back. We stopped all business travel, and we recently started judiciously choosing what business travel was absolutely necessary for our customers and for operations. So we still do not have a lot of business travel going on at this point in time, but all business travel was stopped, and we have increased the amount of work that we're doing remotely for our customers, whether it be consultation, whether it be education, whether it just be providing a phone-to-phone session with prospective customers for the bidding process. We're doing a lot of video conferencing with prospective customers and trying to, promote bringing on new accounts as well. So just because the pandemic hit doesn't mean we've stopped trying to get new customers as well. We're not only trying to keep operations flowing for our current customers, but we're also trying to recruit new customers. So we stopped the business travel. We had a core group of consultant pharmacists for long-term care as well that were going into skilled nursing facilities on a monthly basis. We stopped their travel into facilities so that we are protecting those residents that are residing in the long-term care facilities, because as you mentioned, they are at increased risk. They're a vulnerable population. So those consultant pharmacists as well are pretty much doing what they need to do remotely. They're using a lot of the data that we have in our computer systems, as well as making phone calls or reaching out via emails to their respective sites to get information that they might need in order to do a thorough audit of their respective facilities on a monthly basis.
Has there been anything with regard to sanitizing, packaging, any of the product that we're sending out?
Absolutely. Prior to the pandemic, we were sending all of our things that we could via delivery drivers to our long-term care facilities and to our personal care facilities, skilled nursing facilities. We were sending them in plastic totes. Once the pandemic hit, we discontinued the use of the plastic totes, and we started cardboard boxing everything, for one thing. We put into place a quarantine system. So when we're receiving things back, whether they be from correctional facilities or from long-term care facilities, we have a quarantine process in place. The boxes are brought back, they're quarantined. Now they are quarantined for 72 hours because initially we were seeing that the recommendation was that for plastics, we needed a quarantine period of 72 hours. A lot of our medication cards, the inserts are plastic, even though the medication cards themselves are cardboard, which would suffice with a 24-hour quarantine, as would the box that they are returned in. But because of the plastic inserts, we're quarantining for 72 hours. And then once they've been quarantined for 72 hours, then we are disposing of the boxes. We are disposing of the used medication cards that are brought back. We are using gloves when we're handling product. We always used gloves when we were packaging product, but we are using gloves a lot more now, even when we're handling products, whether they be returned products, whether they be products that we're packaging to put into cardboard boxes to send to customers. Staff is all using gloves right now, and we do have a process in place now that if we do have anything that needs to be or is required to be in some type of plastic tote, we have a thorough disinfection system in place to make that happen. They're brought back. We have a cleaning process that we have in place, and we have a way of getting things back timely into circulation so that they can be used again.
We have local retail operations here in Indiana. We have a medical supply store. We also have a drugstore, a community pharmacy that's been here since 1970, since the Zillner family purchased it. And so what was dealing with infection control procedures like for retail institutions? I mean, in some ways, you have perhaps maybe a better hold on things within our buildings here, our production facilities, but with retail, you have the general public. So how did you respond to those particular challenges from a retail perspective?
Well, from a retail perspective, obviously the first thing was to protect the employees that work at these sites, because as you said, Adam, we did not have the capability of just closing down a business. We're a pharmacy. We're providing medications and we're providing medical supplies to the public. So it wasn't like we could lock the door and say, well, we're not going to operate during the course of this pandemic. So the utmost priority number was to try and protect the employees who were working there. So we started looking, obviously, at the physicality of the building itself and how we were going to social distance customers and protect our employees. So the first thing that went up was the plexiglass, as did with a lot of different organizations and businesses. So we do have the plexiglass up. We do have markings on the floor, such as a lot of businesses, reminding customers of the 6-foot distancing. We have a lot of signage up regarding social distancing, regarding mask use, requiring the mask use for individuals when they are entering into the building. Obviously, with CDC and the PA Department of Health, if you do have a health condition that is not good with a mask, then we're complying and allowing that customer in without the mask. But for the most part, folks are wearing the masks in, providing our staff education on how to keep themselves safe, providing them the equipment that they need in order to keep themselves safe, offering alternatives to having individual customers come into the actual pharmacy or into our medical supply store by alternatives like shipping things, drop shipping things, delivering. We have delivery drivers who we use to deliver products within our community. So we had a lot of different options for folks in the Indiana area that needed either medications or medical supplies. And we continue to provide them some direction and guidance as things change, as well as just being there for moral support. And I think that's the biggest thing with not only retail, but with our individuals who are working in all of our other buildings, is just providing that moral support and letting them know that we are here for them and that we care about them.
Yeah, we care about care.
Yes.
That's the motto. We're going to take a short break and we'll be right back with Debbie Yackuboskey.
We're going to take a quick break from this dialogue to bring you more dialogue. In this case, dialogue, DIALOG, stands for the Diamond Information and Learning Opportunities Group. It's Diamond's in-house speaker and continuing education bureau. If you have a group or facility with continuing ed needs, Dialogue can help set up an in-service for you. Our expert speakers and educators include pharmacists specializing in gerontology, anticoagulation therapy, and HIV. And we also have certified registered nurse practitioners and educators who specialize in disease states and well-being, and also numerous professional staff with expertise in everything from human resources management to safety and disaster preparedness. Dialogue also offers an LPN IV certification program for licensed practical nurses in Pennsylvania. This 8-hour course is approved by the PA State Board of Nursing to satisfy the mandated regulation to allow an LPN to manage and initiate IV therapy. This class is only open to facilities, organizations, and groups of 5 or more. For more information on courses and continuing education opportunities, please contact Trina Plazio at 800-882-6337, extension 1100. You can also visit diamondpharmacyltc.com/learn/dialogue. And now, back to PodcastRx.
All right, we're back on PodcastRx with Debbie Yackuboskey, the Infection Control Coordinator for Diamond Pharmacy. We've been talking COVID-19 and the infection control response as an organization that Debbie was leading with the COVID task force. really there is no facet of the operation that's been untouched by this pandemic. You're overseeing that as infection control coordinator, and there's so many moving parts. Of course, you have the help of the task force. I was curious, is this the first time you've ever dealt with a pandemic or any kind of a disease outbreak as an infection control coordinator throughout your career?
Pretty much it is, because this is the one that's actually hit home the most. I mean, we've had other issues in the past with things like SARS, with MERS, with swine flu, but those have been more internationally located, and they've not been primarily in the United States, or they've not been a global pandemic, such as what COVID-19 is. So this is pretty much the first one, and I've been around for a while now.
Yeah.
So this is pretty much the first one that I've had to deal with as far as a global pandemic is concerned.
A professional and personal question, if you will, here. Have you, at any point, were you ever feeling completely overwhelmed? Like going back to March, suddenly here in Pennsylvania, schools are shut down, non-essential businesses are closed, all within a matter of weeks of our original episode date, March 12th. And of course, cases are exploding. So with all that going on, did you ever feel personally like, oh my goodness, what is going on here? And am I keeping up with it?
Oh, absolutely. I don't think there's not a person out there who has been dealing with this pandemic that hasn't felt that. Just because there's so much uncertainty with it. It's a novel virus. We did not know a lot about it at the onset. We were learning as everybody else going along was learning about it. And over time, things have changed. What we were told initially at the onset of the pandemic is not what we're doing now, because we know more about the virus and there's more research going on.
Of course.
So it is very fluid. It continues to be very fluid. The virus that we're dealing with now is not quite the virus we dealt with back in March and April. So it's changing, and we're learning ways of changing with it as we're going down that road.
So we're going to switch gears a little bit, and I wanted to ask you, Debbie, you're also the supervisor for the LPN Med Exchange program within the long-term care division here at Diamond. So what exactly does that portion of your job entail?
All right. What the LPN Medication Exchange Technician Department entails is the fact that we have a group of LPNs who have vast long-term care experience, in addition to medication exchange technicians who have healthcare backgrounds, whether they be as med techs, whether they be as certified nursing assistants, whether they have worked in healthcare in general in some way. They are brought on board, they are trained into the position, and these guys and gals are the individuals who go into our long-term care settings to take the medications that are routinely taken via what we call a cycle fill. And a cycle fill basically is they're taken out every 29 days, every 30 days, every 15 days, whatever the facility has chosen, that they have their medications refilled. And they take these medications out to our facilities. They are accessing the medication carts. They're putting the medications into the carts. They're final quality control because they're looking at the medications as they're putting them into the carts. They're returning the empty carts back for disposal. They are also involved in auditing of our facilities. We are required to do, per regulations, auditing of skilled facilities monthly, and then personal care facilities, we do those upon request. So we are in medication carts looking for things that similarly their regulatory bodies would be looking for organization of carts, for cleanliness and hygiene of carts, to make sure that they don't have discontinued medications sitting in carts, the whatnot. So there is an auditing component for that department, as well as there's a huge problem-solving customer care component, because as I had said earlier, a lot of our interaction with our customers is done via telephone, via emails, via faxes. So actually seeing folks who are employees of the pharmacy in your building, sometimes you get an opportunity to deal with issues that they might be having on site, or you may have just frustrated staff who just want somebody to listen to them.
Of course.
So customer care and service is a big component of their job.
With that, we got to circle back to COVID-19. So being that has been especially, and brutal was a good way to describe that as far as how it's affected long-term care facilities, not just here in Pennsylvania, but throughout the country. How has that changed what the LPN Med Exchange program does on a day-to-day basis?
That's changed it dramatically. And I think the biggest way has been with, are we allowed entrance into a facility to do a medication exchange? A lot of facilities have closed their doors to visitors and continue to have their doors closed to visitors. We have some of our facilities that just want their medications dropped off, and then their internal staff then puts the medications into the cart. We have facilities that want us to continue to go in and provide that service. So what I've been asking facilities when we're providing that service is that I do not want my LPNs and medication exchange technicians going into areas where residents are residing or areas that they're using. I don't want them to have any contact with nursing stations. So ever since about probably mid-March, I've been asking for areas that are away from that. Conference rooms, classrooms, foyer areas. We've even gotten creative and done medication exchanges outside in order to make sure that our employees are safe. Now, obviously, we also have gone a step farther. If we have a home that we know has COVID positive residents or staff, then they have been asked to do their own medication exchanges. I don't want to expose diamond individuals to areas that have the potential for having them contract the COVID. And then also, we have a lot of folks that go into multiple facilities in one day, including our delivery drivers.
Sure.
And obviously, when we're going into all these sites, we're having the COVID screening. There are certain questions that have been being asked. There's temperatures that are being taken. And, you know, if you answer yes to the question of, have you been in a COVID positive facility, oftentimes they don't want you in their the next facility.
Right.
So if it's a COVID positive site, we are just dropping the medications off and letting the staff go ahead and do it themselves. If it's not a COVID positive site, then, as I said, we are asking for areas to do those exchanges that are away from residents and nurses' stations.
By and large, has that been pretty easy across the board to get those alternate areas for the med exchange?
It's been fairly easy if you're looking in skilled nursing facilities because they're larger facilities. Sure. They usually do have things like conference rooms or classrooms, things like that. A little bit more difficult if you're looking at a mom and pop personal care home.
True.
That has a small dining area, doesn't have conference rooms, doesn't have classrooms. So it's been a little bit more challenging with those areas.
I can imagine. I also know that you're a nursing consultant for long-term care facilities. How, just in general, has dealing with this pandemic affected what you do as a consultant? Are you educating more now on pandemic-related stuff? Any other areas that have changed as a result of dealing with this?
Yes, I am fielding a lot more emails and telephone calls from, some of our customers with pandemic-related or COVID-related questions. I'm getting a lot more emails from our consultant pharmacists who go into our skilled nursing facilities with questions that maybe they've received while they've been communicating with their respective sites. So we are getting a lot more questions about the COVID-19 in general, as well as what are some of the processes and what are some of the things that can be put into place to protect individual residents, staff members, and just people in general going in.
So you've long taught courses for our educational conferences, which we just officially learned were canceled for 2020 and be rescheduled in 2021. Those are, for those unaware, these are continuing education conferences for long-term care personnel in the state of Pennsylvania. And Debbie, you've taught a lot of courses for those. Do you think you're going to become more in demand as an infection control expert for these educational conferences and in any other setting, even in services or any other educational platform that you do?
I can see that. I mean, if COVID continues on and things are continuing to change, definitely. Prior to our education conferences being canceled for this year, my topic was going to be on wound care, and then the pandemic hit. So my topic for the educational conferences was going to be the coronavirus. And, some of the interventions that can be used out there, and just talking a little bit about what the infectious disease experts are recommending. So I was in the process of getting that PowerPoint ready because our first conference was scheduled for September 2020.
Right.
Our last COVID teleconference, the question arose to me as to what was my feeling on having that first conference in September. And I immediately said no.
Sure.
I said, we are not in a position at this point in time to have a live conference. There's so much that's changing, and the fact that it's changing so rapidly. And I, for one, just did not feel having a live conference, nor did I think that our participants would appreciate having a live conference in September. So I made the recommendation to push to 2021. And as you said, Adam, we are going to be having, tentatively at this point in time, we're looking at some dates in fall of 2021 to have these educational conferences. And obviously, if COVID continues to be topical, that certainly is something that I will be reviewing.
So, Debbie, I know also you run the wellness clinic here for Diamond employees. Now, of course, you have to adapt your approach to that. There's fewer employees here because they're working remotely, but of those that are here, you'd have to set up some special considerations for how you'd been doing things pre-pandemic. So what exactly have you been doing?
Well, we have a small clinic, Adam, here, as you said, and I do see and treat our employees as my patients. It's more set up for acute situations, obviously infections, skin conditions, injuries, those types of things, allergies. So I don't manage chronic disease, but I am set up for acute conditions. And when the pandemic hit, as did most offices and clinics and the whatnot, they kind of shut down. And that's exactly what I did. And as with most clinics and physicians' offices, then you had to get a little bit more creative on how you were going to be able to treat. So I, as well, have gotten into the telemedicine, and I've been working with our employees from that perspective with treating conditions for them. As well as just emails, telephone calls, and things like that, so that we can continue to manage acute conditions for our individual employees, but we can do it in a safe manner. The clinic area is very small. I'm not set up to deal with a COVID positive individual. So if we suspect that that's the case, and I get someone who I suspect is a COVID positive individual, we're making referrals to areas that can take care of that person and that is set up for that type of situation. So we are able to continue to manage the acute infections and skin conditions and things like that. And if it's anything beyond, such as a presumptive COVID, then they're referred elsewhere.
Right. Largely following the trend of telemedicine that you're seeing out in the wider world, too.
Yes.
Yeah. To kind of close out our conversation, I wanted to ask you a kind of twofold question. Because of your experience in long-term care, what are some of the long-term changes that you could see happening in long-term care as a whole as a result of the pandemic?
Well, we're seeing some things now. I mean, I have some personal experience on both sides of the fence here, per se, in the fact that I've been dealing not only as a nurse and a nurse practitioner through this pandemic, but I've also been dealing as the daughter of a father who had to have long-term care during the pandemic. So I've gotten it from both perspectives, and there's been a lot of changes. I mean, obviously from an internal perspective, there's been a lot of changes to protect the residents in the fact that residents have been more isolative and have not been allowed to be in communal settings, whether it be the dining room, whether it be the activities room. There's more on one-on-one. So moving forward, I can see that continuing where they're doing more one-on-one with residents or small groups. I mean, looking at what the recommendations are out there, even just for the public, smaller groups obviously are better than larger group situations. So I can see that change coming where maybe they're going to do smaller groups for residents in the nursing home setting. Staff education, as we had mentioned earlier, has been key. So I think ongoing, they will continue to provide a lot of staff education with respect to infectious disease processes, the COVID-19, if it continues to be an issue out there, or anything else that might arise. They've internally changed a lot of processes as well with disinfection, with laundry, with kitchen areas, with cleaning, whatever. So it's not a bad thing. I think moving forward, it's a good thing. And I think it would behoove them to continue with the heightened processes that they have in place. I know that's what I'm planning on recommending here for Diamonds, is just continuing with a lot of the good things that we do have in place even once the pandemic is over. And another thing that's been happening in the skilled care has been in personal care as well, is the fact that the screening of visitors. I mean, obviously right now, not a lot of facilities are allowing visitors, but I can see the screening of visitors continuing to some degree and in some way or fashion down the line to protect residents and staff. So, everything that we're seeing evolving over the last 4 or 5 months with COVID have been what I feel are some nice processes or procedures or policies for the good. And I would hope that some of those would stay in place moving forward into the future.
And you slightly answered the second half of my question, which was going to be what of those good things here at Diamond within this operation do you see changing then as a result of the pandemic?
Well, some of our disinfection processes, which we've heightened up, just some of the workflow, which we've heightened up. Obviously, there's going to be a place and time when we have to start bringing folks back, but we've got some nice social distancing going on right now in our public areas. I've been adhering to the PA Department of Health recommendation that in our break rooms, that we social distance as well as we face everyone forward. So in the break rooms, we've removed chairs. We have everyone facing forward. It doesn't seem to have been an issue for folks. And I make a lot of surveillance throughout the buildings. And as I said, folks are complying to it. They've been very cooperative, and I can see that continuing down the line. I think just the education piece alone has been tremendous because I can see more hand washing going on. I can see more disinfection going on. We increased our housekeeping activities here. I can see those continuing down the line. So there's been a lot of more positives rather than negatives out of all of this, which I'd like to see continue moving forward.
Absolutely. And more positives over negatives across the board throughout the world as we all get through this together, for sure.
I agree.
Well, Debbie, thank you so very much for joining us today and sharing your expertise about infection control, and we really appreciate it.
Well, thank you for having me, Adam.
Absolutely. This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.
Music in this episode by Wolfgang Worley. Sound expressed by Getty Images. Additional music by the 126ers and Silent Partner.